In 2017, the British Virgin Islands were rocked by 2 Category 5 hurricanes that left the land and its people devastated. The Mental Health and Psychosocial Support Project came about after the hurricanes of 2017 to address the psychological and emotional issues that resulted from the devastation caused by the storms.
First, I'd like to thank CDB for their investment that we made immediately after the storms of 2017, and especially by having part of this particular funding investment in the Community Resilience, Mental Health, and Psychosocial Support Project. This is critical for us because in addition to the physical rebuild of a territory, we paid notice that the psychosocial, the mental health was critical in rebuilding the community, because we cannot have a sustained society without the capacity of our people, and this was critical for us at this time.
When disasters happen, or when there are emergency situations, naturally people begin to help themselves. And we would have noticed this across communities after the 2017 storms. People in communities cooperated together to do things until other help came.
When we look at what folks have gone through immediately after the storms of 2017, those persons who may have sought shelter from some area, they basically did not have this anymore. Government recognized this and was intent on making sure that the funding, and through the help of CDB, as we mentioned before, was able to be placed in this direction. It is critical that we develop these particular programs all through the communities, that we have them readied for the next storm, the next pandemic, the next critical or catastrophic event that may come to the territory.
So if you looked at that picture, you began to think about how can we make this better? And that led us into thinking through what can we do so that the next time something happens, our communities can be better prepared.
The objective of the project was to build local capacity for the delivery of mental health and psychosocial support in disaster preparedness, response, and management within the health sector and broader community.
For the Mental Health and Psychosocial Support Project, we wanted to look specifically at helping persons to understand their own responses that they may be experiencing after a disaster or any emergency. And so things like looking at anxiety, looking at the stress and the stress response, and looking essentially at things that persons can do, techniques, skills that persons can use to help them to be able to cope better, were specifically the areas that we were looking at.
I would definitely be an advocate for persons to learn psychological first aid, as it helps in traumatic events and environmental disasters to help direct persons who are under distress and give them tools in which they can cope with what has been happening or what has happened.
The Bounce Back Stronger campaign of the British Virgin Islands can serve as a prime example of the inclusion of mental health and psychosocial support as a critical component of the country's public health emergency response. This initiative, with core objectives focusing on strengthening local capacity, developing community resilience, and the accurate monitoring of these activities, highlights the importance of prioritizing mental health and psychosocial support in emergencies.
One of the takeaways I got was I would call it a formula. I kind of devised the name, but the facilitator talked about 3 L's: look, listen, link, which is how to deal with trauma or traumatic incidences. Look basically is to assess the situation. What are the issues that are pending? What do you have to do? What are you dealing with? What is the issue at hand? Listen, collect the information you need. Who do I need to contact? Who can help me? Who do I need to make contact with to make sure that I can get the help I need? Look, develop a plan. You first have to accept the situation as is. Now, what do I do? How do I formulate a plan to make sure that I am successful?
The project also sought to build community resilience and establish action plans for emergency preparedness on a community level.
A resilient community is one in which people naturally help themselves. But what can we do to make that response better? So we thought that, one, we could identify persons who are active in their communities. We could train these persons to enable them to plan, to build social networks, to coordinate. And then one of the issues that was one of the things that was an issue during the aftermath of the storms was that a lot of carers did not really pay attention to themselves. So we felt that going forward, an important thing to do would be to have an element of the project that focused on psychosocial support, so that people could learn to stop and reflect for themselves, look at their own needs, and make provisions for their needs.
Community resilience is important in time of disaster and adversity, because with community resilience, there will be a community plan. Everyone, all the various agencies will be able to work together and to know their role. And you will also have very good community participation, and people will be able to bounce back better and more resilient because they would have worked together.
Community resilience training has helped our communities drastically. We've been working on several initiatives, including working along with the Department of Disaster Management to draft and edit disaster management plans. The community has also assisted in several debris cleanups to get the communities more disaster ready. And we've been working with several schools to ensure that the students are also knowledgeable of what they should do in the wake and after a disaster. Through this project, we were able to develop resilience teams on Anegada, Virgin Gorda, Josephine Lake, and across Tortola. Through these teams, we were able to spearhead several initiatives, and they in themselves helps to keep the community more ready.
Persons were trained on the Mental Health Gap Action Program Humanitarian Intervention Guide, MHGAP-HIG, as part of Scale-Up Care for Mental, Neurological, and Substance Abuse Disorders. It was geared for non-specialized health workers and persons who may be involved in providing psychological support in emergency situations.
The MHGAP training will help improve the delivery of services in the territory by building capacities to non-specialized healthcare workers like the nurses, the midwives, the social workers in assessing, identifying, diagnosing, and managing mental health conditions.
It's a significant investment that has been made, and investing into mental health of the community is, especially in this time, is critical. So it would be important to continue to monitor and ensure that persons learn the practical skills, and so you want to make sure that those skills can be refreshed.
As a primary care physician who has taken part in this training, I definitely think it will really be a positive benefit to the territory. The reality is that there are a lot of persons who are out there with undiagnosed mental health issues. And the truth is that if and when they do make contact with the healthcare system, it would not be to a specialist, but to us here in the primary healthcare sector. So definitely what this training has done is that it has helped to reinforce our knowledge base, and it has also helped to augment our skills in terms of detecting these mental health issues and also basic management protocols that we can implement until the individual may get to that stage where they may need referral.
This would also help them be more confident in coming to the clinic and seeing mental health cases rather than just referring them to the psychiatrist. Also, it will benefit the community by avoiding the stigma associated with visiting the mental health offices.
We want to make sure that persons who were involved have opportunities to continue to develop those skills because, you know, the point is we live in an area of the world where we're prone to disasters that can happen at any time. And we know that with climate change, that, you know, there's a prediction that we're going to have more of these types of events that can be stressful on the community. And so it would be important to continue to monitor and make sure that persons don't lose the skill.
And we basically did trainer sessions. So our responsibility and our role then is to train our colleagues in terms of, as I said before, recognition of these mental health issues and how basically to give the best care to our patients.
After the hurricanes, just when we thought we were starting to return to some semblance of normalcy, the pandemic struck in 2020, presenting multiple challenges for the people and government of the Virgin Islands. To respond to these challenges, the Mental Health and Psychosocial Support Project was repurposed and new activities were added to respond to the new mental health demands on the ground. The government was committed to strengthening mental health and building community resilience.
Having identified that people were willing to help themselves and having identified that there were things that we could do, we were able to establish groups within communities that had no formal groups. We were able to train them in coordination of activities and to give them knowledge about the disaster management cycle, and to enable them to identify the other persons in their communities who were also helpers within that community so that they could cooperate together.
We've always had resilience in our DNA. All this project has done is give us more tools that we can access quickly so that we can deal with any event. And that has been helpful not just to myself. I have 2 children. It's been helpful with them, dealing with the pandemic and dealing with the different changes they've had to go through, even wearing a mask and having to be washing their hands, sanitizing everywhere, being socially distanced. That formula has basically been a godsend to the process of dealing with this new pandemic and way of life.
I mean, the way that I have seen this play out is persons who previously may not have been working in this area, who may not have known about things like psychological first aid, who participated in the various trainings. Some persons have actually gone into their own communities, into their organizations, the churches, and they have formed groups that will carry out the role of helping to respond to the community. I also see more persons who reach out and ask for information. So it is more on persons' minds, and as the information goes out, you know, the communications materials now circulating, persons are becoming more aware and sensitive to the information and sensitive to the importance of being mentally well and being able to cope and understanding that you have the power within you to really deal with any eventuality that you may be faced with.
We've looked at strengthening mental health and psychosocial support by forming a technical working group to coordinate the various agencies and groups that are working in mental health. I think this is very useful and it has a lot of added value going forward. We are now in a position where our people who have always been willing to help themselves now have a better understanding of who they are, what their community is, who are the most vulnerable within their communities. They have looked quite focusedly at the disaster management cycle, and we've imparted to them some capacity to develop plans and to coordinate their work.
The government of the British Virgin Islands has been a pioneer in our region on this critically important topic. This partnership between the British Virgin Islands, the Caribbean Development Bank, and the Pan American Health Organization has been fundamental in strengthening mental health and psychosocial support in disaster management and serves as an exemplary model for the region.
We have been able to train groups within various communities. We've been able to train nonprofit organizations, train churches, train a number of organizations that have been charged with looking at the mental health of our community. And I think that by us doing this, whether it's on Tortola, Virgin Gorda, Anegada, Jocelyn Dyke, we would be able to lend from this investment and further this, even as the years go by.
I think I'm a better person, I'm a better mom, I'm a better counselor, having gone through the process, and I see myself continuing to use the skills I've been taught.
The government of the Virgin Islands continues to invest in strengthening mental health and building community resilience of its people.